Did you know that doctors can instantly detect serious health problems simply by observing certain hygiene habits in their elderly patients? These seemingly harmless routines could be quietly signaling dangerous health issues developing inside your body right now. What's truly alarming is that most seniors remain unaware they're making these crucial mistakes every single day. In the next few minutes, I'll expose the 7 personal hygiene errors doctors immediately recognize in their older patients and how correcting them could literally save your life or the life of someone you care about. The insights I'm about to share aren't taught in schools, rarely brought up during medical visits, and almost never featured in health magazines. Yet they could mean the difference between enjoying a healthy retirement or suffering preventable. Let me introduce you to Harold, a 75-year-old retired engineer who believed his personal care routine was flawless. Harold stayed active in his community, played golf twice weekly, and never missed his grandchildren's baseball games. But during what he thought was a routine checkup, his doctor immediately noticed 3 critical hygiene mistakes that revealed Harold had been unknowingly developing a serious condition. "I had no clue," Harold later admitted. "I thought I was taking good care of myself. If my doctor hadn't spotted these minor hygiene issues, I might not be here today to tell my story." Today, I'll share exactly what those mistakes were so you can avoid Harold's frightening ordeal, and more importantly, I'll tell you precisely what changes to make, simple adjustments that could add years to your life's start. Mistake 1. When was the last geriatric specialists, eh? But don't just take my word for it. Consider Sylvia, a 68-year-old retired teacher from Oregon. Sylvia ignored her bleeding gums for months, thinking it was normal at her age. "I just figured that's what happens when you get older," she said. But during a routine physical, her cardiologist found dangerous inflammation in her heart valves caused by oral bacteria traveling through her bloodstream. The doctor warned that What should you do now? First, check your toothbrush. If it's older than 3 months or shows signs of wear, replace it immediately. Ideally, switch to an electric toothbrush, which removes 62% more plaque than manual brushing, according to research at the University of Pennsylvania Dental School. Brush twice daily for a full 2 minutes each time. Set a timer if needed. Floss every night without exception, and never skip dental checkups. Mistake 2, infrequent. How often do you bathe? Be honest. Many seniors bathe less frequently as they age, but did you know your skin is your largest organ? Changes in its condition can reveal serious internal problems before other symptoms appear. Consider Clark. What's the solution? Set a regular bathing schedule, at least 3 times per week, even if you're not very active. Use mild, fragrance-free soap that won't strip your skin's natural oils. After bathing, apply moisturizer while your skin is still slightly damp to lock in hydration. Most importantly, regularly check your skin for unusual changes in color, texture, or sensation. Are you noticing dry, flaky patches, persistent itching, or discoloration? These might be your body's way of warning you about serious intake. Mistake 3, ignoring in. Take a moment to look at your fingernails and toenails. Are they neatly trimmed, clean underneath, free of discoloration? Nail condition offers a window into your overall health, something doctors check immediately when examining elderly pets. According to the American Academy of Dermatology, nail changes can indicate over 20 systemic diseases, from anemia to thyroid problems to heart disease. Their research shows that in patients over 65, nail abnormalities led to the discovery of previously undetected internal conditions in nearly 30% of cases. Let me share Beatrice's story. At 82, she thought her thick yellow toenails were just part of aging and hid them by wearing closed shoes. "I figured it was normal for getting older," she told me, but when she finally saw a podiatrist for foot pain, the doctor diagnosed a fungal infection that had flourished unchecked. This revealed her severely weakened What should you do today? Trim your nails regularly, straight across with slightly rounded edges to prevent ingrown nails. Keep them clean and dry. Wear breathable footwear and change socks daily. Never ignore changes in nail color, texture, or thickness. These aren't cosmetic issues, but potential warnings from your body. Are your nails brittle, discolored, or thickened? These changes aren't inevitable with age. They're your body's urgent message. Will you listen before it's too late? Mistake 4. Improper incontinence management. This is perhaps the most shocking hygiene mistake because of its prevalence and how many try desperately to hide it. Over 50% of seniors silently deal with some form of incontinence. The truly alarming part is how many hide it instead of seeking proper treatment. Urologists from Johns Hopkins Medicine report that untreated incontinence can lead to dangerous skin infections, falls, social isolation, and may even mask serious conditions like bladder or prostate cancer. Their studies show seniors who manage incontinence properly experience 60% fewer complications than those who hide the problem. Jake Douglas, a 73-year-old retired accountant from Arizona. He was too embarrassed to mention occasional leakage to his doctor and used paper towels and frequent clothing changes, thinking he was managing the issue. When he finally confided in his doctor, Douglas was diagnosed with a treatable condition that, if ignored, could have led to severe complications. Embarrassment often stops seniors from seeking help, but the truth is that managing incontinence properly can dramatically improve quality of life. What should you do right now? Don't be ashamed to talk openly with your healthcare provider about any bladder or bowel control issues. There are effective treatments and products designed to help. Maintain good hygiene by changing protective pads regularly and cleansing the skin gently but thoroughly to prevent infections. Using barrier creams can protect sensitive skin from irritation caused by moisture. Remember, untreated incontinence can cause far more than just discomfort. It can lead to dangerous infections and falls, so early intervention is vital. Mistake 5. Ignoring foot care. Have you checked your feet recently? Foot problems in seniors are often overlooked but can have serious consequences. Poor foot hygiene or untreated injuries can lead to infections, ulcers, or even require amputation. Podiatrists emphasize that daily foot inspection is crucial, especially for seniors with diabetes or circulation issues. Look for cuts, blisters, redness, swelling, or any signs of infection. Wearing ill-fitting shoes can worsen foot problems and cause painful sores. Consider Joan, a 79-year-old retired librarian who ignored a small blister on her foot. It quickly worsened, leading to an infection that required hospitalization. She wishes she had paid more attention to her foot care sooner. To avoid such risks, wash and dry your feet thoroughly every day, especially between the toes. Moisturize your feet but avoid lotion between toes to prevent fungal infections. Wear properly fitting shoes and never walk barefoot, especially outdoors. Schedule regular foot exams with a podiatrist, particularly if you have diabetes or circulatory issues. Mistake 6. Skipping hair and scalp care. Hair and scalp care might seem trivial, but ignoring it can cause significant discomfort and health issues in seniors. Dry scalp, dandruff, or fungal infections can lead to itching, hair loss, or infections that affect overall well-being. Older adults often experience changes in scalp condition due to hormonal shifts or medication side effects. Regular washing with gentle shampoos keeps the scalp clean and healthy. Avoid harsh products that strip natural oils. Mary, an 80-year-old retired nurse, ignored her itchy scalp for months, attributing it to normal aging. When she finally sought help, she was diagnosed with a fungal scalp infection that required medical treatment. What should you do? Wash your hair regularly with mild moisturizing shampoos. Use a soft brush to stimulate circulation and remove dead skin gently. If itching, flaking, or hair loss persists, consult your healthcare provider for diagnosis and treatment. Mistake 7. Not hydrating enough. Dehydration is a common but overlooked risk for seniors that directly impacts skin health, cognitive function, and organ performance. Many older adults don't drink enough fluids daily due to decreased thirst sensation or fear of frequent bathroom trips. Doctors warn that mild dehydration can cause confusion, urinary tract infections, constipation, and worsen chronic conditions. Skin may become dry and less elastic, increasing susceptibility to injury and infection. Take Frank, a 76-year-old retired pilot who didn't realize he was dehydrated until he developed severe urinary infections and confusion. Increasing his fluid intake with the help of his doctor greatly improved his condition. What should you do? Aim to drink at least 6-8 glasses of water daily unless otherwise advised by your doctor. Include hydrating foods like fruits and vegetables in your diet. Monitor urine color. Pale yellow indicates good hydration, while dark yellow suggests dehydration. These 7 hygiene mistakes are not just minor oversights. They are critical health indicators that demand your attention. By recognizing and correcting them, you can protect your health, preserve your independence, and live your later years with vitality and dignity. Don't wait for a doctor to spot these signs for you. Take control of your personal hygiene today. Your life may depend on it. Sought medical help only after painful sores appeared, doctors found an advanced prostate condition that could have been treated months earlier with far better results. My pride almost cost me my life, Douglas confessed. I wish I had talked to my doctor at the very first sign instead of trying to hide it. So what should you do if you experience any kind of incontinence? First, never feel ashamed to discuss bladder problems with your doctor. They encounter these issues daily. Use proper absorbent products made specifically for incontinence rather than improvised solutions. Change promptly when wet and follow a proper cleansing routine to avoid skin damage. Most importantly, understand that incontinence isn't a normal part of aging. It's often a signal that medical attention is necessary. Do you notice occasional leaks? Find yourself planning outings around bathroom access or rely on makeshift protection? Don't wait another day. Talk to your doctor about these symptoms. Your health, and possibly your life, could depend on it. Mistake 5. Ear hygiene errors. What's your routine for cleaning your ears? Be honest. Do you use cotton swabs and insert them deep into your ear canal? If yes, you're making a dangerous mistake that many seniors make daily. Many older adults damage their hearing and miss signs of serious infection due to improper ear cleaning. Research from otolaryngologists reveals that nearly 40% of ear canal injuries in people over 65 result from improper cleaning, often leading to infections that could have been avoided. Take Patricia, a 71-year-old retired librarian from Washington. She regularly used cotton swabs deep inside her ears until she punctured her eardrum, causing a severe infection that spread to surrounding tissue. "I always clean my ears like that," she said. "No one ever told me it was risky." Patricia needed emergency treatment and suffered permanent hearing loss that was entirely preventable. What's the right way to clean your ears? Remember this simple rule: never insert anything smaller than your elbow into your ear canal. Clean only the outer ear with a warm, damp washcloth. If you suspect excess wax, use eardrops specifically designed to soften wax and follow the instructions carefully. Seek medical care immediately if you experience pain, discharge, or hearing changes. Do you have itchy ears, a feeling of fullness, blockage, or unexplained hearing loss? Don't try to fix these problems yourself. They need professional medical evaluation. Your hearing is precious. Protect it with proper care. Mistake 6. Poor foot hygiene. When was the last time you thoroughly inspected your feet? Not just a quick glance, but a detailed look between toes, heels, and soles. Your feet offer crucial clues about your circulation and nervous system, which doctors check first in elderly patients. Podiatrists specializing in geriatric care at the American Podiatric Medical Association report that foot hygiene issues often reveal early signs of diabetes, neuropathy, and vascular disease. Their studies show that in patients over 65, good foot care and regular inspections can prevent up to 85% of diabetes amputations. Yes, 85%. Consider Raymond, a 76-year-old retired factory worker from Illinois. He ignored dry skin and minor foot cuts, assuming they were just normal signs of aging. "My feet looked rough for years," he admitted. But during a routine check, his doctor noticed the condition and ordered diabetes testing. Catching the disease early when lifestyle changes could still help. "If my doctor hadn't checked my feet, I might have gone years unaware I had diabetes," Raymond said. "By then, the damage would have been severe." What should you do starting now? Wash and dry your feet thoroughly every day. especially between the toes where fungus. Regularly check for cuts, sores, or changes in color or temperature. Wear clean, dry socks made of natural or moisture-wicking fibers. Apply moisturizer to dry areas, but never between the toes. And never ignore pain, numbness, or wounds that won't heal. See a healthcare professional immediately. Are your feet dry and cracked? Noticing cuts that won't heal? Discoloration or loss of sensation? These aren't cosmetic problems. They are early warning signs of serious conditions needing urgent care. Mistake 7. Medication hygiene issues. Are you on multiple medications? Have you noticed changes in body odor, sweating patterns, or dry mouth since starting them? Medications that keep you alive might cause hygiene problems, signaling dangerous side effects. Pharmacologists at the American Geriatric Society document that many commonly prescribed drugs cause dry mouth, excessive sweating, or body odor changes indicating potential toxicity. Their research shows nearly 40% of adverse drug reactions in seniors first appear as changes in personal hygiene before more serious symptoms develop. Take Barbara, a 67-year-old retired nurse from Florida. Her unusual body odor was dismissed by family as poor hygiene until her geriatrician identified it as medication toxicity, slowly harming her liver. "I was showering daily and using deodorant," Barbara said. "I had no idea the smell was coming from inside, not from being unclean." How can you protect yourself? Track hygiene changes after starting new meds. Keep a simple journal noting body odor, sweating, dry mouth, or skin changes. Stay well hydrated unless told otherwise by your doctor. Report unusual sweating or odor changes to your doctor immediately. They could signal harmful drug interactions. Never adjust medication dosages without medical advice, even if you suspect hygiene issues are medication. Have you noticed unusual body odor despite regular washing, excessive sweating, severe dry mouth? Don't chalk these up to aging. They may warn of serious medication effects needing urgent care. Now you know the 7 crucial hygiene mistakes doctors spot immediately in elderly patients and exactly how to fix them. By addressing these issues today, you can prevent serious health problems, maintain your dignity and independence, and possibly add years to your life. Remember, good hygiene isn't just about appearance or social manners. It's vital for your health as you age. These simple changes could literally save your life. If you found this information helpful, please hit the like button right now. Has your doctor ever noticed any of these hygiene problems during visits? Share your experience in the comments below. Don't forget to subscribe and hit the notification bell for more potentially life-saving health info like this. And please share this video with loved ones over 60. This knowledge could literally save their lives.